family physician from Southern Oregon, about 35 years in practice, and Senate for the last 10 years, in the House, combination. But on this trail since 1989, 1988, so this is the accumulation of 25 years of effort, 329, and then the Health Authority with Ben Westland, and it's I believe a time that we're on the cusp of actually changing the system we've been trying to change for 30 years. I would caution us, though, that we only have 5 weeks to do this. 25 years condensed into 5 weeks. And if we start arguing about where we're sitting and the size of the table and what the rules are going to be, we're never going to get this job done. We've only got 5 weeks to do it. We're going to hand something off to the Oregon Health Authority, essentially, apparently, from what our governor just told us. But I want some pretty tight sideboards on that, pretty clear picture of what we're trying to do. We need to do the things that have been talked about for 25 years. That's primary and preventative health care. That's coordinating health care. And that's global budgets for people who do not want global budgets. That's hospitals and doctors and other providers. We have some real stiff competition outside this room, and many of the people in this room are not going to like some of the things we're going to be talking about and some of the changes we think need to be made. If those changes aren't made, the system will collapse. And I believe we're within 10 to 15 years of that happening. So I'm looking forward to being here and doing some hard work the next 5 weeks. But remember, we've got to get it done. And it's got to get done quickly with a handoff that's clean. We have a healthcare system that is too expensive, as everyone knows, and doesn't produce the outcomes we need. I won't go into the statistics on it. The basic problem in our healthcare system, I believe, are 2, possibly 3. First one is we don't have enough primary and preventative care. That is the key problem in our system. We don't like to admit that. You go to any other system in the world, and you'll see about 60 to 70% of the providers, be they nurse practitioners, physicians, or others, are in primary care and preventative care, and 30% are in specialty care. We are the opposite in this country, and we are driving ourselves in the wrong direction under the healthcare system we have of fee-for-service for very expensive specialty care at end-of-disease treatment, primarily in hospitals. We will go off a cliff if we keep doing this. So transformation for me is that kind of a change, going to a primary care preventive system that really makes sense and starts to work. That's not going to happen in the next 5 weeks, but we can lay the groundwork for it. The second issue, again, goes back to global budgets. We have uncontrolled costs in healthcare, frankly, primarily being driven by hospital costs. That has to be brought under control. And the third thing, which nobody wants to talk about, is defensive medicine and medical malpractice, which is outside the work of this committee, which will have to be carried on in other parts of the legislature. So that's my bottom line on it. Hope it's clear. And I know we're not going to get there in 5 weeks, Senator Cruz, but we'll get a good start at it.